Hello and welcome everyone to today's information webinar for the Lancet Countdown Indicator Development Award on Mental Health and Climate Change. I'm Jennifer Israelsson. I am one of the research fellows here with the Lancet Countdown, and with me today we also have James, who is the research fellow for our Working Group 1, and we've got Camille and Sam from our operations team. So James will provide an overview of the work of the working group and their research priorities. I will then walk you through some of the key requirements your application must demonstrate before I will hand over to Sam, who will go through the contractual and financial bits of the call. And finally, Camille will walk you through the practical steps of actually applying for this call. After we've done all the presentations, we will open up for some questions and answers. We are recording the session for anyone who's unable to attend this webinar. And any questions that we don't have the time to address during the webinar, we will post the answers to the webpage where we had the call. So without further ado, handing over to James.
Okay, thanks, Jen. Can I move things along? Yeah, perfect. Thanks, Jen. As mentioned, my name is James, and I'm the Research Fellow for Working Group 1. And I'm just going to give you a quick kind of run through about what we do to kind of set the scene for the rest of the call. So Working Group 1 is focused on health hazards, exposures, and impacts. And of course, as we know, climate change and health are interconnected in many complex ways. And the aim of the working group is really to, sorry, the slides aren't moving. The aim of the working group is to track and understand how exposure to climate-related hazards impact our health and well-being, and also better understand the underlying vulnerabilities across different populations. So that's kind of the overarching theme of the working group. Now, this research group is led by Professor Ollie Jay at the University of Sydney and Professor Matilde Rostacucci at the University of Buenos Aires. And they are supported by myself, the research fellow, as well as Philomena and Jake, who are also based at the University of Sydney. And then propping us all up is the fabulous Jen, who is based in London with the central team, and she kind of holds us all together. Now, Working Group 1, as it currently is formed, is separated into 4 key domains. The first of these is focused on heat and health. And under this key domain, we have a number of different indicators that track things like the exposure of vulnerable populations to heat waves, the impact of heat on physical activity and labor capacity, the impact of rising nighttime temperatures on sleep loss, and of course, the impact of extreme heat on human mortality. The second section of the working group focuses on the impacts of extreme weather events, including things like wildfires, drought, extreme precipitation, and the health impacts of air pollution from sand and dust storms. The third section of our working group is focused on the climate suitability for infectious disease transmission. And this year we've separated this into vector-borne diseases such as malaria or dengue, and then waterborne diseases, things like Vibrio. And then finally, we have a standalone section which focuses solely on food security and undernutrition. So that kind of gives you a kind of a good overview of what Working Group 1 currently looks like. And within this working group, we have a number of kind of cross-cutting challenges that we try to address each year as we refine our suite of indicators. Now, the first kind of cross-cutting challenge is to try to differentiate between climate-related risks or potential risks versus more direct health impacts. And there's an important distinction there. And teasing those differences out can be slightly more challenging than you might expect. Secondly, we aim to better understand climate vulnerabilities and which populations and which members of societies are most at risk when it comes to climate hazards and what we can do to better protect these vulnerable populations. Third, we have a focus on, sorry, third, we have a focus on attribution. And this is really centered around trying to precisely quantify exactly the direct influence that climate change is having on human health outcomes and being able to directly attribute the impacts of climate change on human health. And then finally, we are trying to do a better job of understanding and acknowledging that climate risks often don't occur in isolation. They often occur together, and the impacts of these um, um, compounding impacts can amplify the effect that it has on systems across the board. And that's a really consideration for our working group moving forward. Now, just to kind of finish off, to give you a taste of working group one, we have identified three uh, key priority areas which will enable us to improve our suite of indicators. The first of these is trying to do a better job of teasing out the direct health impacts of climate-related hazards on human health. So here we're talking about how do climate hazards impact things like mortality, morbidity, absenteeism from the workplace, the real direct impacts on human health and well-being. Secondly, it's been brought to our attention that the transmission of foodborne infectious diseases is becoming an increasing problem around the world. Now, we do have an indicator currently that looks at waterborne infectious diseases, but moving forward, we would like to extend this section of our working group to better account for foodborne disease. And then last but not least, it has become clear that there's an urgent need for a better understanding of how climate change and climate hazards are affecting our mental health and psychological well-being, how these events are impacting our psychological state. And again, this knowledge will help us inform ways of better protecting societies when extreme climate events strike. So on that note, the topic of mental health is the topic of today's webinar. So I'll hand you back to Jen, who will tell you more about the open call for a mental health indicator. So thank you very much.
Thank you, James. See, right. So as James was saying, we know that climate change is having an impact on really all areas of our health and well-being, and the evidence on the impact on mental health from climate change is really rapidly growing. In the past decade, we've seen multiple studies come out that is showing the impact on everything from kind of anxiety and depression to PTSD and suicide. And these are all resulting in long-lasting impacts and substantial burden of disease. But despite that, we have this growing evidence base and numerous international efforts really focused on understanding the link between climate change and mental health. We are still lacking indicators to track these impacts, particularly when we look at the global scale. So as James mentioned, developing this indicator on mental health and climate change has really emerged as a key priority, particularly as we ran our Lancet Countdown consultation with stakeholders last year. So at the beginning of the year, we ran a couple of exploratory workshops where we had over 140 global experts to really help us understand the state of the evidence. And that informed this Lancet Countdown on health and climate change launch to call for applications to develop an indicator to monitor the health impacts of climate change. So that's kind of the background. Looking at some of the really sort of key requirements and criteria that we will be judging your proposals on. First of all, your indicator proposal must really clearly describe the link between a mental health impact and a climate change related weather events. And this can be extreme heat, it could be flooding, it could be any kind of hazard that is established being impacted by climate change. Given that we have a global focus here at the Lancet Countdown, any proposed indicators must be possible to monitor across the world, and it must therefore account for differences in coverage, definitions of mental health, and availability of mental health services, both within countries but also between them. And when we talk about global, we say that at the end of the project, your proposed indicator must be fully developed and cover at least 40 countries with a clear roadmap to increase that coverage up to at least 150 countries within 2 years. Given the scarcity data on clinical mental illness, we really encourage applicants to explore proxy measures that can reliably reflect changing impacts on mental health. Examples that's been provided are proxies such as suicide, sentiment, mental health emergency attendance, but this is definitely not a list. We definitely encourage you to explore others as well. Since we know that people's mental health is affected by a wide range of factors, your proposed indicator must clearly describe how it deals with confounders and also how the observed mental health impacts are attributed to the climate change related variable. I just want to clarify here that we don't require the mental health impact to be attributed to climate change, but it must be attributed to the climate variable of your indicator. In addition to these sort of academic criteria, a really key priority for Lancet Countdown is to increase the representation of low middle income countries in the global research landscape and to promote capacity building for the next generation. So in addition to the method section, all successful applications or the successful application will also need to demonstrate how they will have meaningful engagement with low and middle income countries. And that can be that you, as the lead applicant, is coming from the country, you're partnered up with someone from a country identified as such, or it could also be through partnerships or capacity building activities. We also need you to provide opportunities for early career researchers and describe how you would do that. And this is really to ensure that any funding that we're giving out is not only advancing the science, but also helping to build that capacity. Successful applicants must also commit to deliver this indicator and participate as an author annually for at least 3 years. We want to flag that there will be no further funding to maintain this indicator similar to our other report authors. So any accepted indicator must be possible to update annually without that additional funding. But on the other hand, you will get to work with this lovely bunch and be an author on our annual report. Finally, successful applicants will also have to work quite closely with the Lancet Countdown team to develop this indicator, and that will include things like regular meetings with the team. We'll probably have discussions and refinements of the method to ensure that it really aligns with the Lancet Countdown's methodological and analytical frameworks. And this is to ensure that the indicator that comes out in the end actually can fit into our annual monitoring report. Finally, details. Only one application will be accepted for this call, and we will award a maximum funding of £100,000. The project should be somewhere between 6 and 18 months. We will open the call or the application forms on this Monday, 1st of June at 8 AM UK time, and it will close on the 12th of July at 5 PM UK time. All shortlisted applications will go through an external peer review process before a selection will be made. So we can't say exactly which stage you will hear, since that will depend on this. But we will unfortunately not be able to provide individual feedback as well. Right, I will hand over to Sam to go through our details.
Great, thank you, Jen. Yes, just by way of an introduction, my name's Sam. I'm the finance manager in the Lancet Countdown team based in the Global Secretariat, and I will quickly talk you through now 2 key components of the application, which is your finances and your contracting. So I'll be touching on Three things here: the award letter, letter of support, and your eligible costs. And I will also do a quick budget demonstration on the Excel form that we're asking people to complete. Slide. Oh, sorry. So firstly, the award letter. Successful applicants will be required to sign and agree to the terms outlined in the grant sub-award letter. A template of this document will be available in the application pack for your review. The sub-award letter functions as the award letter for your grant. It is designed to flow down the terms of our primary award for the Lancet Countdown, incorporating Wellcome's grant conditions. These terms will govern your award and should be adhered to. We have obtained agreement from Wellcome to deviate from their standard IP position to ensure that all intellectual property arising from this award will be owned by yourselves as the awardee. An important thing to note here is that the terms of this award letter are intended to be non-negotiable. So in the same way as if you were applying for Wellcome Trust funding, there isn't a negotiation between your organisation and the funder. The award letter terms and conditions are non-negotiable and shouldn't be subject to review. The reason we're stipulating this is it's in order to avoid protracted contract negotiations and to enable the project to commence promptly. Right. There we go, sorry. So letter of support. So the next thing I will quickly talk you through is the letter of support that we're asking applicants to complete. And we are requesting that applicants to complete this and have it signed by the relevant authority within their institution. This letter should confirm the institution's approval of the project and, importantly, your willingness and ability to accept the funding under the terms and conditions set out in the sub-award letter. So please do read through the sub-award letter that I talked about in the previous slide, because we are asking in your letter of support to confirm that you will be able to agree to these terms. An editable template of the letter of support is available in the application pack. You are welcome to use this as a guide. However, please ensure that the final letter clearly incorporates all approvals and confirmations referenced in the template. And finally, I'll talk quickly through eligible and ineligible costs on these applications. So a comprehensive list of all eligible and ineligible costs are available in the guidance for applicants document located on page 13. Please do look through this document, as we spent quite a lot of time making sure that it's got all the information that you need to develop your proposal, but do get in touch with myself if you have any queries regarding the finances. So as the primary funder for this work is the Wellcome Trust, we are therefore mirroring their eligible cost criteria for this call. So three important things to note here. Principal and co-investigator salaries should only be requested if the member of staff is dependent on external sources of funding to sustain their contract. So we are asking that people who are core funded and have permanent roles within the university, your salaries would not be eligible on this call. But if your contract is grant funded, and this is what is providing your contract of employment at your organisation, then your costs are eligible on this call. Unfortunately, overhead and indirect costs are ineligible. The funding should only be used for direct project costs. Additional collaborators are permitted. It is the responsibility of the lead organisation to put appropriate collaboration agreements in place with any additional research partners and to manage the flow of funds between parties. So you'll have a lead applicant, which would be yourself, and collaborating organisations, which would form part of a collaboration agreement or a subcontract. And it would be your organisation's legal team that would put this in place. So if I just share my screen quickly, I'll give you a quick run through of what the budget Excel looks like. So I think we can see that, Jen, can we? Is that all okay on the screen?
Yes.
Yeah, all good.
Great, thank you very much. So this Excel document will be available in the application pack that is linked on the website. And this will be the landing page, which will provide a summary and some instructions of how to complete this form. So I will do a quick demonstration and follow the instructions that are available here. So firstly, you'll be asked to populate the highlighted organisation details here. So if I was applying for this fund at UCL, the lead applicant would be UCL. Collaborating organisation 1 would be a partner organisation. So in my demonstration, I will go Oxford as University of Oxford, and I will go Oxford and Cambridge as University of Cambridge. Filling this in, populate down here what will eventually be a breakdown of the funding that will be assigned to these organisations. Once you've entered the organisations who are applying, so the lead applicant and any collaborators, you will need to provide a detailed breakdown of costs required for each organisation under each budget category. And you'll do so by going onto this worksheet here. This is the detailed budget breakdown, which is the second worksheet. So we are trying to be as simple as possible in requesting costs for this call. The bit that requires the most detail is the staff cost section. Up here, you'll be able to select from the organisation dropdown, which relates to the organisations you'll have entered into the budget summary, and you'll simply just need to complete and populate the form as required. So if I was applying for this call, and my role would be principal investigator, you'll be flagged, referring to the guidance for applicants about whether your salaries are eligible, and you'll just simply need to complete the form. 2 months employment, a total cost of £5,000. You then do the same for any of your partner organisations. So if I do example 2, and this person is a researcher, 50% FTE for 12 months for a cost of £5,000. This will then start populating the summary breakdown in the previous page. We're then asking everyone to provide their further breakdown of costs, so their direct costs for the projects by completing the tables down here. And we're only asking that each organisation provides the lump sum, the total value that they're requesting under that cost heading. So if playing as UCL, we would provide a description of materials and consumables, and we would put the total cost for materials and consumables that we're requesting under this call. So for a cost of £5,000, that will then be assigned to UCL. So once you've completed the budget breakdown, once you've got your budget summary and you're happy that the costs assigned to each organisation are matched and aligned with what's been provided, you will then save this document and upload it to your application as prompted. So that's all from me. So I think I'll hand you over to my colleague Camille.
Thank you. So my name is Camille. I work in the operations team as the program manager, and I will lead you through, take you through the practical steps on how to apply. Thank you. So I'll show you the web page and then the application form in a minute, but just to give you an idea, I've shared the link to the call webpage on the chat. If you get there, you'll be able to see the course details, and that's where you'll be able to download your application pack and your guidance document. The first step that we advise people to do is to download the guidance for applicant and read it through. It's got all of the details that you need to participate in the call. It's going to be taking you through all of the details that Jen has shared, as well as practical steps. And as Sam mentioned, you'll find all of the eligible costs and financial details there as well. So yes, as a first step, please read this in full. And then from this page, you'll be also able to get into the online application form and to download your application pack. So in the application pack, what will you see there? You will be finding your budget spreadsheet that Sam just talked you through. That's the template you need to use and that you will need to upload as part of your application. You will also find there the template for your host institution support letter. So use that, have it signed on letterhead by your institution, and then upload it as part of your application. You'll also find the template of the sub-award letter so that you and your institution can read through our non-negotiable terms and conditions. And you'll also find there the Lancet Countdown's internal policies that we will ask you to read through and comply with should your application be successful. I will now take you through the web page where to find all of those things, and then I'll quickly take you through the application form. So I will share my screen. Here we go. So first, if you click on the link that I shared within the chat, you land on this page. That is the call page. There you find a few details about the call, what the call is at a glance, the the application stage, which is not yet open, which will open on Monday. Here, once we get through with this webinar, we will upload the recording so you can watch this back if you need to remind yourself of any details. And then that's also where you can download your guidance, our guidance document, and download the application pack. This here is the link to the application form, which if you click on there, you won't be able to apply yet, but it will open on the 1st of June. And then if you at any point have any questions that are left unanswered by the guidance for applicants or this webinar, feel free to reach out to us and ask questions through this email address. We will also collect all of the questions that will be asked through this webinar, and any request that we get through the info at we'll collect this in an FAQ document that will be available there as well. So just to show you quickly what the guidance for applicant looks like, I won't go through it. I'll leave it to you to peruse, but basically it provides you with the background that James and Jen have presented to you. Then it goes through all of the criteria for funding, both academic and operational, and it will take you through how to apply, the terms and the key things to know about the terms and conditions, and some references. So this is all available through the webpage, and then our application form is through Qualtrics. So that's basically what you land on if you click right now. But I will take you through the actual application form and what it looks like. So if you bear with me, I'll share the multiple windows open on the computer. Here you go. I'm trusting you can see that. So I will now quickly walk you through the application form so you get a sense of what it looks like and know exactly what we are expecting in each sections. So as I scroll, I will highlight the key things you need to focus on. So first, we start with our project team details. So that's where we collect basic information about the project lead and the project team. So we ask for name, contact details, discipline, organizations, including whether it's academic or something else. There are a few eligibility and background questions. For example, whether you're an early career researcher or not, which answers one of the questions we got in the Q&A. You also need to declare any conflicts of interest and confirm you have read our conflict of interest policy, which will be part of the application pack. So it will be there for you to read. And then you can add up to 5 additional team members, and including their roles and career status. I'll quickly roll through that to get to the next section. Here we go. So next, you get to the core of the application where you describe your proposed indicator. Of course, you start with the name, how long it would take to develop the project. As Jen mentioned, we're looking for projects that last from 6 to 18 months. And then you will be asked to provide a short, non-technical overview of the indicator and how you will develop it. You will notice each section does have a character limit that is clearly displayed. And then we will ask you to explain a few things. So first, what mental health impact you'll be tracking, which climate variables, you link it to, and the evidence behind that relationship. You'll need to describe your data sources, including access, limitations, and data privacy considerations. We will also ask you about geographic and temporal coverage. You will find here all of the eligibility criteria in the descriptions. So it's all in there. There will be a section on methodology where we hope to for you to explain how you'll analyze the data and produce the indicator. And importantly, you will also need to explain how the indicator will be useful for policy and decision making. And finally, in this section, you will also be able to include a sample of what the indicator output might look like. This is optional, but we found that this usually helps us get a better sense of what you have in mind. So if you can, please use that. So we're looking for indicators that are robust, scalable, policy relevant, so be clear and practical. And next, we have this very important section where we ask about your overall research plan. This includes your vision, the methodology, the timeline, the key milestones for your project. And we also want to understand risks and how you'll manage them. Basically, you need to show us you have a clear project plan, that your project is feasible and well thought through, and that your deliverable timeline matches with your time frame. And then we get on to the next section, which focuses on how your project aligns with the project countdown's core values and principle. So first, you need to explain why this funding is essential for your project and what difference it will make for the feasibility and the development of your indicator. We'll ask about equality, diversity, and inclusion, engagement with low and middle income countries, opportunities for ECRs, and capacity building. These are all things you need to consider within your proposal development, as Jen mentioned earlier. You will also need to confirm commitments around open access, compliance with our internal policies, which are all included in the application pack again, and to confirm you understand this work will entail ongoing collaboration with the Lancet Countdown team and network. And finally, you get to the part where you will need to outline the financial side of your project. As Sam said, you can request up to £100,000 for this work. You need to provide. You need to mention whether you've received funds from UCL before. There's a question on currency management. Then you can provide the total budget for your project, and then there will be a place where you can upload your spreadsheet that you will have downloaded as part of the application pack and completed, and then you can upload it there. And then finally, getting to the end of this, you get to the final section where we ask for a few admin requirements, the contact details for your finance and contracting point person. That's where you can upload your letter of support, and you'll need to confirm agreements on privacy or peer review process and acknowledge any potential overlap with existing indicators. And here you go, you're through. So yeah, that's basically it. I'm going to stop sharing now. And I think we're all through. Jen, correct me if I'm wrong. And this is time for us to answer some questions. I see there's a few in the Q&A. If you would like to ask a question live, please feel free to raise your hand. And yeah, as I mentioned in the chat, so we'll take as many questions as we can right now. We have about 20 minutes left. Anything that's left unanswered, we'll collect and gather in an FAQ document that will be available through the webpage. So, first question, are national societies in and outside of the UK eligible to apply, such as, for example, the Red Cross and the Red Crescent societies? Sam, I see you've unmuted yourself. Do you want to take that?
I can take that one. Yeah, so broadly, NGOs, so in terms of eligible organisations, within the guidance for applicants, there is a section that mentions this, and it links directly to Welcome's information about eligible partners and organisations on call. So we're mirroring that here. So yes, broadly, NGOs would be able to apply for this as long as you are able to sign up to the terms and conditions within the award letter.
Thank you, Sam. Next question. Based on the criteria for application, and must to fulfill are there. So what about for the newcomers who are early career researchers to join the Lancet Countdown team? I'm not sure what this exactly means, but whoever asked that question, please feel free to raise your hand and I can give you the floor. And in the meantime, I'll just get to the next one. Will you support an individual researcher without a current institutional affiliation? Sam.
Yeah, let me take that. Unfortunately, for this award, we are only able to contract with organisations, so it will have to be an actual organisation that signs up to the terms and conditions of our letter. It's not for individuals, unfortunately.
Thank you. How many co-authors can be included on this indicator? For example, to accommodate a global and geographically diverse team. Jen, I think you can take that one.
Yeah, absolutely. So for the actual indicator development call, you are welcome to have as many co-applicants as you want, as long as they fit within that maximum budget of £100,000, and you can kind of make it work. It is up to your organization to sort out kind of sending money to other organizations. When it comes to having your indicator in the Lancet Countdown report, as a standard practice, we have maximum 2 authors per indicator. If it is a very complex indicator or there are some other sort of special circumstances, we can make an exception, but kind of as a general rule, you are allowed maximum 2 for the actual Lancet Countdown report.
Just to quickly say about funding for additional organisations, we haven't put a limit on that either. So what I will say is the budget form has been set up for 5 collaborating organisations plus a lead applicant for a maximum 18-month call and a budget of £100,000. I can't imagine that there would be a need or a feasibility to have more partners than that. If you would like to, then please do get in touch with me directly and I can update and amend the form to provide fields for extra partners. But I would just say be cautious and be wary and ensure you're trying to be practical with the time and the funding that's offered.
Thank you both. Next question. During the application stage, is it expected that applicants should have already chosen one indicator that they will then fully develop if successful? Jen, would you like to take that one?
Yeah, happy to. Yes. So that is the point of it. That you will provide us with, this is the idea, this is the mental health impact that I will suggesting that we track of this climate change related variable, and this is the method that I'm proposing. It doesn't have to exist already. We will require any indicator to go through to be published in a peer-reviewed journal before we can accept it into our report. But yes, you need to have developed that idea fully.
Thanks, Jen. If you'd like to come in about this question about early career researchers and give us more details about it, please raise your hand. Another question just came in. What are the eligibility criteria for non-profit organizations?
So yeah, I think that's similar to the question that was asked earlier. So yes, non-profit organisations can apply as long as you're able to sign up to the terms and conditions that are within the award letter document.
Thank you. We don't have any more questions at this moment. We do still have some time, so if you'd like to ask any questions live, please raise your hand. Happy to take any questions that you may have. I'll give it a couple of minutes, and if nothing comes in, we'll just close the webinar and we'll make the recording available on the webpage.
I think just to clarify, since we had a couple of questions on it, early career researchers, you are very welcome to apply to the school. We highly encourage to have at least one early career researcher as part of your research team, even if you're not the lead applicant.
Thank you, Jen. Sam, do you want to take this next question that came in?
Yep, that's fine. Yes, so short answer, yes, we do. So you will see within the application, there will be a section that's called adjustment support. So this is something that Welcome are quite good with, and it's something they include all of their calls. So as we're mirroring Welcome's calls, adjustment support would be where you would request those costs.
Yeah, and just for the purpose of the recording, the question was, do you fund disability accommodations to help complete the project? Thanks, Sam. Ranjan, would you like to come in? Let me find you in the. There's a question coming. Okay. Ranjan,
Can you hear
hello.
me?
Please come in. Yeah, we can hear you.
Yeah, I'm sorry, I joined late because of some internet issues. What I want to ask is a non-profit organization from a developing country, can it apply along with an university or researchers from, say, Europe or US, like we are from India? So if we want to, sort of take on board some professors or researchers from the Europe, is it possible?
Yep, so I can answer that one, Camille. Yes, so yep, to reiterate, that's absolutely fine. Non-profit organizations are eligible on this call. The important thing is that your organization is able to sign up to the terms and conditions that are provided as part of the applicant pack. So as long as you can agree to those terms, all good.
Okay, thank you so much.
Mhm.
Next question. Is there any option to get help for getting data from your side for countries that are difficult to get? I think, Jen, maybe a question for you or James.
Generally, we are not able to help with getting data. It is up to the indicator authors to get hold of the data that they need for their indicator. Of course, we're welcome to discuss, but kind of as a general, we don't really have any options or routes to request additional data.
Thanks, Jen. We don't have any other questions so far or raised hands. I'll give it a minute and then we might just close the webinar. Okay. So as there's no further questions, I think we will take this to a close. As we said, if anything comes up that is not covered in this webinar or in the guidance for applicants document. Oh, here we gotta raise hands. Please go ahead. No? Oh, that was. Is it possible to get help through proposal writing? Would you like to maybe give us some more detail, or Jen, are you able to take that question?
We're not able to kind of help you with putting together that proposal. I don't know if you might have some support from the institution, but we are not able to help with kind of actually putting together your proposal for you.
Thanks, Jen. As I was saying, if any other questions come up, please feel free to use the info@ email address that's in the website. It's all there and it's going to be monitored the whole time the call will be open. Another question just came in. Is there any turnover limit one organization need to have to be eligible for the grant? Sam, I don't think there is.
Turnover limit.
A turnover limit.
No, there isn't, but you will be asked to comply with UCL's due diligence policies if you haven't worked with us before. And that will ask some information regarding your institutional turnover and things like that, which would be reviewed by our compliance team. So there isn't a limit. You would be expected to provide that information as part of your onboarding and due diligence checks.
Thank you. Excellent. I think we will bring this to a close. Every time I say this, another question comes up. Can individual applicants participate in more than one application for this opportunity? Jen?
That was it. Yes, you can be part of more than one, but you can only be the lead for one.
Thank you. I'm giving it a few minutes this time, if anything comes up, as we still have a few minutes to spare. But I really want to thank all of our panelists today for your time. Yeah, we're very excited for this call to launch. Okay, nothing's coming up. So I think this time we'll be closing the webinar. Any other questions, feel free to reach out through the info at. Anything that comes up and that's left unanswered, we'll get through in the FAQ document that we will be publishing on the website. As I said, the recording will be available online, so if you have any doubt, please rewatch it. You can send it to your colleagues, and yeah, we're very excited to launch this call on Monday. Jen, James, do you have any final words before we close?
No, just thank you so much for joining us today, and thank you for asking all of your questions. As Camille was saying, really excited to see all of your proposed indicators.